Good morning, Jane Thomason. Welcome to the Global Thinkers Forum Conversations with Changemakers podcast. My name's Helen Disney. I'm the CEO of Unblocked, a company which organises blockchain and emerging technology events, information and research. And I'm delighted to be speaking to Dr. Jane Thomason today, who is a social impact guru and has spent most of her career as a change maker. So welcome, Jane. Please tell us a little bit about your career in social impact and digital health, and how the current Covid-19 crisis is impacting on you.
Thank you so much. It's great to be with you, and I really appreciate being part of this series. I've always thought that somehow I could change the world, and from a very early age, I became really interested in the problems of developing countries, of poverty, of inequality, of disadvantage of women and so forth. And so, in fact, my very first job was as a volunteer in Indonesia, like a Peace Corps or a VSO, where I went and I learned, a tremendous amount of things about a country where people don't have all of the privileges that we have and how people live and disadvantage and so forth. And so I spent most of my life actually working in countries in Asia and the Pacific, initially through healthcare and then later working on governance and women's empowerment and other issues. And so I had developed over a period of many years a deep understanding of some of the challenges of the more fragile economies of the world. And I'd been working on them again for many years. And I started to learn about blockchain in about 2016. It was actually as a result of my son chiding me for not having bought Bitcoin in the early days when he told me to. And then he said, "Mum, you need to learn about blockchain because this is going to change everything." And I felt pretty guilty about not having bought Bitcoin, so I thought I'd better learn about blockchain. And I did. And then one day, my head was full of reading about it and trying to understand its distributed nature and the cryptography and proof of stake and all of these things. And I was sitting there one day reflecting on the Banda Aceh Boxing Day tsunami, which we had actually been involved in the rehabilitation stage of. And it was a tremendously tragic event that took a lot to get over. But I was sitting there thinking about blockchain, and it suddenly hit me. It wouldn't have changed the tragedy of the situation. It wouldn't have changed the loss of life, but it would have made the rehabilitation so much easier. Because if you think about it, 200,000 people were washed away. No one knew their identity. So no one knew who was lost. No one knew who was in the camps. All the bank records were gone. All the land records were gone. All the health records were gone. And then donors started flocking in by the thousands, and no one knew if their help was actually getting to the people who were in need. And I just had a moment of realization that if in fact we could bring these technologies together and people could have had identities and we could have reconnected with their various records in the cloud, it just would have made the reconstruction so much better. And that was the moment when I thought, I have to follow this through. I have to learn about how digital transformation can really impact on poverty and inequality. So since 2017, I've really made that my mission.
It's so fascinating. And I think you and I both came to this in a similar way, because I also got interested in Bitcoin, but then more interested in the underlying technology of blockchain and how that could be applied not just to money transfer, but to social transformation. So when I first started hearing about the kind of social and economic possibilities of blockchain, that was what got me really interested in it as well. So it's great that we've both kind of gone on a similar journey from different starting points. And I think, what you've said is so relevant to obviously the terrible crisis that we're finding ourselves in now with COVID-19, because so far we've had a lot of focus, obviously, naturally on what's happened in China, which has been horrific. And now this is spreading into Western nations. So there's a heavy focus on the US and on European countries like Spain and Italy and the UK, which are now being badly affected. And that's where I live. But obviously the crisis is in, I think, more than 195 countries now. So it's also spreading into developing countries. You mentioned Indonesia, obviously African nations as well are starting to be affected. It's going to be very different there. They don't have the kind of healthcare system infrastructure that we do in the West. So what do you think things are going to be like there, and how is it going to really play out on the ground?
Look, I think things are going to be tremendously challenging. And I've had conversations over the last weeks with people in Africa, people in India, people in Indonesia. And I mean, we're struggling enough to cope with the pandemic in our own settings, where we actually live in countries with good health systems, where we have homes that we can be locked down into. And one of the things that we're observing in countries, you have a lot of people who live on the streets. They don't have a home to go to. They've come to the city. They might have a food van. They might sell small items on street corners. When a lockdown comes, they don't have anywhere to go. And so what you're seeing in a number of countries is this pattern of lockdown, and then these people migrating back to their villages and falling into extreme poverty. So one of the things that we're working with and talking to the government of Indonesia about is how can you use technology to see what's happening to these people and to map what's happening in terms of people falling into extreme poverty, identifying pockets, and then thinking about what you can do about that. I think we're going to see this same pattern mirrored all around the developing world. But the other thing that they're seeing in Indonesia, and I'm not yet sure, looking at some of the African countries, is much higher death rates than what we're seeing here. So the fatality rates are higher, and I think you're potentially going to see that both because of the vulnerability of the population, but also because the total inability of the health system to be able to cope with that. And these are hard conversations to have when you're talking to people who are employers and just thinking about the statistics of, you know, maybe 50 or 60% of your workforce are going to get this virus, and then, you know, based on the case fatality rate in your country, then you might lose up to 10%. And so, you know, they're really challenging numbers. And I think that while we need to obviously cope with our situation and that of the ones who are around us in the developed world, I also think we need to turn our attention and think about how we can support developing country governments to cope with what is likely to be a far worse catastrophe than the one that we're seeing.
Yeah, I mean, those figures are absolutely tragic and almost impossible to get your head around from the point of view of the human cost and the number of people. Everyone is going to be affected in some way by the loss. Thinking about the technologies you've mentioned, I mean, maybe you could just explain a little bit about what blockchain is for people that don't know it, and how some of these emerging technologies like blockchain may be combined with other technologies like artificial intelligence could help us. We've obviously spoken already about, you know, the idea of being able to sort of have an identity and not lose records like land records, or be able to keep track of people's healthcare. But could you explain a bit about whether you think there's any solutions that we have that are ready to go now that could be employed rapidly to help the kind of people that you're talking about?
Well, what's interesting, and I'm really trying to follow this, is what we're seeing is people who are already building a particular kind of a product, pivoting to be helpful during the epidemic. And one that you're very well aware of, and I think is worth talking about, is Punya Care, where you know, there was a woman who was worried about her mother in India, and so she was trying to develop a remote monitoring mechanism so that she could be tracking what was happening to her mother's health in India and using AI to get a health score and having a wearable device and so forth. And so she's now in talks with one of the leading university hospitals in London about possibly deploying this for remote monitoring of coronavirus people suspected with coronavirus who are in isolation. So we're seeing that kind of thing happening. We're also seeing people who are developing platforms to address some of the issues that we've seen coming out of China. And one of them, there's two things. I think there's fake news and there's fake products, because apparently what happened in China was that a lot of people started kind of creating face masks that didn't meet any of the specifications. And so, you know, that blockchain capability of tracking provenance and ensuring that the products are what they're supposed to be is something that has been used. And the other one is this is our first social media pandemic. And so we're all subjected to an absolute barrage of news and information. And it's not always easy to verify, you know, what of this information comes from a credible source. So there are people who are working on that. You know, other things that people are using blockchain for is in China and Hong Kong, insurance payments, making them faster and automated, and with smart contracts paying them when they're due. I think that we're going to see, and people are starting to work on these things like, if we do want to get donations or cash transfers to vulnerable people, you're going to be able to use blockchain and smart contracts to make sure they get to the right sort of people. And we're already seeing an increase in the use of digital everything. So I think cash is done with. I think this pandemic is going to finish us using cash, and we're already seeing that. So there's some of the things, but I think in terms of helping people, you know, who are staying at home, you're seeing quite a development both in edtech and gaming and things that keep people occupied while they're at home. And the other piece for blockchain that I think is important is in clinical trials, because there's a number of different ways that blockchain can ensure the fidelity and veracity of clinical trials, and people are trying to accelerate the pace. And one of the things that I've discovered from speaking to a number of people is they're saying the acceleration of technology adoption is going much faster. I was speaking to someone from Grand Challenges Canada a couple of days ago, and she's saying things that would have taken 3 to 5 years in terms of change management around technology adoption are now taking months.
Yeah, that's fascinating. I think the crisis is definitely giving governments such a big kind of rapid push towards digital transformation. I mean, obviously not just governments, companies too, and us as individuals. People that were previously terrified about the idea of doing a Zoom call and now suddenly become Zoom experts, you know. So all of us are being challenged to go digital and to do things online in new ways. What do you think some of the challenges are of getting these projects up and running at speed? Because obviously there is a risk, as you say, of particularly with things like new technologies that are not always well understood, fraud and, you know, those kind of problems of people trying to use this crisis for their own nefarious ends, which is incredibly sad and difficult to process that people would do that, but we're humans and humans will act well and also act badly in a crisis. So, you know, what's the challenge from a government point of view and also from the citizens' point of view? Are we potentially giving up too many human rights and too much data privacy in the sort of panic mode that we're in, which is understandable, but will we end up regretting some of the rights that we've given away?
I think that's an interesting question, and I think that it probably needs to get answered almost on a country-by-country basis. So, you know, for example, one of the things that I know people are working on and trying to get up and running, let's say in the UK and the US, is this idea of a immunity passport, if I could use that term. So there does seem to be increasing evidence that if you've had the infection, that you develop some immunity, and people are obviously desperate to get the economy going again. And so there's a number of different projects that I'm aware of who are working on the possibility that a medical practitioner could verify that a certain person has already had an episode of the virus and therefore should have some level of immunity, which then creates the passport, if you like, for them to go back into the community and to start working again and so forth. So those kinds of things are happening, but at the same time, you're also seeing a number of countries. I believe Israel is using some sort of military-grade surveillance system to track the population to make sure that, people are staying in their homes, or people who are suspected cases of COVID aren't moving around. And I think probably of all of the things that I have heard, it's more this surveillance technology, which is helpful and important now, but it's the fear that this may become embedded, and everyone's talking about the new normal in terms of, the future of work and so forth. But if the new normal is also that the government can surveil all of our banking data and all of our telco data and so forth because it was necessary during a time of crisis and continue it, I think that's probably the risk. I think the risk is less now during the crisis because, a pandemic like this demands extreme measures. I think if that then becomes normalised, then that will become an issue for people.
Yeah, and I guess, we've seen some of this where I live here in the UK with the police using drones to see whether people were going out and driving to have walks in the countryside and this kind of thing, and powers that are being brought in as a temporary measure. But obviously, if you've got a country where you have a democracy and a political opposition, then at least political parties can push back against temporary measures and say, now it's time to go back and not use these powers anymore. Other countries that don't have those kind of democratic processes, may not be able to follow those same kind of oppositional tactics, and so we could be losing quite a lot as a society in the obviously very important goal of solving this current crisis. So we need to remain alert to all those challenges with technology, I think. I wanted to come on to...
I think it's the what happens after question
Yeah.
is really one that we should be focused on, because at the moment, and quite naturally so, we're just focused on getting through each day and trying to contain the curve and stop people dying and stop the health system collapsing. But at some point there will be a future, and I don't know how we can be sufficiently kind of bipolar to be able to deal with today but still have some people who are thinking about tomorrow. But I really think we do need to have people who are going, well, this might be 12 months, it might be 18 months, it might be longer, but there's a future out there. So how are we thinking about the economy? How are we thinking about rolling back some of these changes that we've made to allow a greater level of surveillance because it's life and death? And then how do we also learn from the fact that we used to talk about the future of work as if it was a theoretical construct where people could be working from anywhere remotely and using digital. Well, we've just all been enforced to discover the future of work. But what's that going to happen? Will people go back on public transport and go to buildings somewhere and sit there for 8 hours a day? I think this is going to fundamentally change the way we think about society and we think about work.
Yeah, so many different aspects, like you said, cash. Suddenly that seems like a strange concept. No one wants to touch notes and coins. Will we ever eat from a buffet again? All these kind of questions, trivial ones as well as more important ones. I wanted to kind of come on to the role of women, because obviously Global Thinkers Forum is an organisation that supports female empowerment and female entrepreneurship. And there's been quite a lot of talk about gender roles. On the flip side, men may potentially seem to be worse affected by the actual illness of COVID-19. But in terms of the kind of social impact of all the changes that we're going through, people have been asking whether or not women are going to be disproportionately affected by the crisis. So somebody like Caroline Criado Perez, who wrote the book Invisible Women, all about how data about women is not always visible in society, and is sometimes covered up or sometimes just not tracked, has spoken about, women are more likely to be in caring professions, looking after children or older relatives. They're more likely to be in temporary 0 hours contracts and so on. they're perhaps more likely to suffer domestic violence because we're locked down with our families and they can't escape from the person who may be harming them. So how do you think this pandemic is going to have an impact on women? And do you think there are other things that we can do to help mitigate that as we go forward?
I think that's an interesting question, because I mean, I do think women are the carers. Women look after the family. Women will look after the elderly relatives. A lot of women will be in the health services and other services that are considered essential. So they're going to be on the front lines. I think the point that you made is really important, because we're kind of rediscovering the family. I think this is such an interesting thing. But if you actually live in a dysfunctional family where there is domestic violence, this is only going to exacerbate that. And I don't think that we've begun to understand what the toll is, but I do understand that there have been significantly more calls around issues of domestic violence. And then obviously mental health, although I don't think that mental health will necessarily disproportionately impact on women. Look, I think what we need to do for everyone, but also thinking about women, is finding ways that we can provide them with help, with information, with a community, with places to go if they're in trouble. And I mean, this is obviously extremely difficult where people are locked down in their own homes. But it's really thinking about that, thinking about groups to give support. One of the things that I've read about is this movement virtually that's happened in Canada, which is now taken off all around the world, called caremongering instead of scaremongering, where their communities are banding together and creating a Facebook group, and where people can help each other, then they do. And where people need help, they can kind of connect with local people. I think this is one of the beautiful things we're seeing around this pandemic, which is that you're starting to regain senses of communities where, you know, maybe they've been lost in the hurly-burly of our busy lives, and people are just coming together and random acts of kindness and support for each other. We're really seeing a lot of that. And I would hope that we can think specifically around, you know, what women's needs might be in this, but we are all in this together, and I think that's a very real thing. There's no one who can slither out of this.
Absolutely. I mean, there was a beautiful billboard that was put up in East London, I think, saying, you know, when you go out and see all the empty streets and the empty train platforms, don't say it looks like the end of the world. Say it looks like love in action, because we're actually trying to care for each other by not going out, you know, and there is positive thought to be taken from all of that and all of the good things that are happening. So many people volunteering, you know, supporting each other, doing good things. And perhaps in the future, you know, the technologies can help in the sense that for women, if we can own our own money, and particularly people in developing countries, if they can have financial assets available to them without infrastructure. So, you know, through a phone, through an app, they can own money digitally, that can help them also to be empowered and to break free from some of the problems that they might be in. So I think it's not something that is a quick fix, but perhaps over time we can start to build those systems that would allow people to support themselves in future. I mean, it was very moving to me reading the book when she talks about how girls in certain parts of the world are not taught to climb trees because of the way girls are socialized. And so when it comes to something like a tsunami, you know, more young girls died because they couldn't climb up a tree and escape from the water, you know, and just something like that is just such a huge thing. Or they're not taught to swim, or women don't receive public health messages or public service announcements because they're in the home, and a lot of the announcements are made in public places, so they don't actually even know that a crisis is happening. So yeah, there's many things that we can hopefully change in the future to prevent all of that from being so, you know, badly impacted on all of us, but particularly on women who may not have access to the same services or the same finances as men in certain parts of the world.
But one of the things I did want to say is that technology has given women voices in countries where they don't have a public voice. And we're seeing that in many countries where women are able to talk on Facebook or on chat channels, to gain support from other women, to kind of champion causes and so forth, because they may not be allowed out in public, they may not be allowed to speak in public, but I think technology and digital and mobile is allowing women to create that support infrastructure that they never could have before. So I don't think we should forget about what it's already been doing for women, you know, over the last decade as mobile technology has become more ubiquitous.
Yes, that's definitely very true. And I mean, even in the West, you know, people are banding together. Women I know in the UK are sharing information about, you know, what kind of grants are available that people can apply for, what government support, to sharing strategies about how to stay positive. You know, this is a good yoga class, this is a good educational webinar about something I now need to know about that I didn't need to know about before. Lots and lots of different things that, as you say, it's a social media pandemic which can exacerbate anxiety, but it can also share, you know, positive memes or just fun things that can keep us cheerful, or helpful resources. So, you know, that technology is having a good impact, as well as, you know, sometimes spreading some of our deeper fears. I'm interested to know how you're personally coping with changes caused to all of us by social distancing. What are you doing in your day-to-day life to stay positive? What strategies have you found effective to cope with what we're going through right now?
Yeah, no, thanks for asking. I thought about that question because, as you know, I'm someone who got on a plane every week and went somewhere. So I led a very busy life, and it involved a lot of travel, and that has stopped. And so this is probably the longest period of time I've been in my home and in one place for a very, very long period of time. But look, I think what we need to do and what's important around resilience is accept the situation that we have and then work out how to make the best of it. And for me, that means two things. One is being very busy, finding things that I can be involved in, whether it's, you know, being on a podcast with you, whether it's working with the government of Indonesia, whether it's connecting with people around the world who are using technology to be able to address the pandemic, or participating in hackathons, or starting an interview series. My days are very busy. So I think that's the one thing, because these can be very long days when you're basically in the house all the time. I think the second one is, and I've always practiced this, and I'm particularly trying to practice it now. I used to have something called an appreciation day, which is, even if things are tough and it's difficult to see your way out, is try and think of things that you can appreciate, whether it's the fact that there's a blue sky or green trees, or there's an attractive looking bird that's landed on your patio, or whatever it is. It's really try and get into a positive frame of mind. And that's one of the reasons why I've really been tracking these good news, random act of kindness stories from the COVID epidemic, because there are people who are being appalling, but there are many, many, many more people who are just being incredible, who are volunteering and who are carrying out generous acts, the health workers who are on the front line, who are working themselves into the bone and taking risks. I feel enormously appreciative of that, and that gives me hope for the human spirit, and that gives me hope for my family, and they're the kinds of things that carry you through. So I do that. I don't watch too much of the coronavirus reports, just enough to know what's going on. But if I do get on the YouTube or the television, I try and watch things that are kind of happy and lighthearted and carry me away from where we are. So they're the kinds of things that I do. And I do think we all need to endure this. This is going to go on for a long time. We need to understand it. We need to try and accept and make the best life that we can with what we've got, because I don't think we have any other choices.
Yes, I think staying positive is so important, and I'm really looking forward to working with you more on how we can spread some of these random acts of kindness and stories of tech for good, and get them to a wider audience, because I think it really encourages all of us when we see, as you say, how hardworking people are, how resilient they are, how flexible and creative they are and innovative they are in using their talents and harnessing them to fix problems of this current crisis. I know a friend of mine and I have started a kind of gratitude diary that we're sharing with each other daily, where we're just making one slide and saying things or putting photos of things that we can be grateful for. But we did have one day where we had a whinge slide, and we allowed ourselves one day to whinge about all the things that were upsetting us. But it's only one day now. We've gone back to being positive again.
But we've all got a community. Pick up the phone, send an email, just make a human contact with people you care about, because it really means something to me. And I've had people reaching out to me from all around the world, and they go, "Are you okay?" And do the same back to people that check in on them, show them that you care, even if you're nowhere near them and you can't actually help. It matters to us that there are people in the world who know we exist and care about how we are.
I think that's so true, and I think we've all been gratified by how many old friends and family members have been in touch, or we've been in touch with people that we hadn't connected with for a while, just to check that they're okay. So human contact is absolutely everything, and hopefully this podcast has inspired others to stay cheerful and to turn their talents to positive goals during this very, very difficult time. So I think we're coming to the end of our time, but I'd just like to thank you, Jane, in general, for all of the work that you do, being a change maker for your whole life and your whole career. But also thank you for coming on to the Conversations with Changemakers podcast.
No, thanks, Helen, and thanks for what you're doing, because I think you've always promoted good and positive things in the world. So, hats off to all of us who are trying to make the world a better place, even in fairly difficult circumstances. And everyone, you can do something, whether it's in your family or in your community or by reaching out to someone. So do those small things, find that moment of appreciation and joy, share it, and help other people now.
Thank you so much, Dr. Jane Thomason, for being with us today on the Global Thinkers Forum Conversations with Changemakers podcast. Thank you also to Global Thinkers Forum for hosting us, and Elizabeth Philippouli for launching this initiative. We both very much enjoyed the conversation, and we wish positive vibes to all the other change makers out there trying to make a difference in this time of global crisis.